Welcome to video 15, Building Cost-Effective Initiatives. Spending more isn't enough. We have to spend better. In the previous video, we focused on why sustained investment matters and why chronic underfunding had left us reacting to crises rather than preventing them. The second video in this two-part video of the series uh, returns to a different but equally important question: how to ensure that new investments actually deliver results. We have to spend better, guided by evidence, data, and a clear understanding of what works over time. Government resources are finite and must be directed towards what delivers the greatest impact. This slide gets to the core of the problem. For too long, drug policy funding has been fragmented, spread across disconnected programs that are slow to adapt, difficult to evaluate, and poorly connected to one another. That approach doesn't work well in today's drug environment. The threats we face now evolve rapidly. Drug markets change, substances change, patterns of use change. Funding mechanisms must be flexible enough to respond quickly to these shifts, using real-time data rather than outdated assumptions or years-old evaluations. When programs are designed this way, adaptive, data-driven, and outcome-focused, they do more than save lives in the short term. They also reduce long-term costs across healthcare, justice, and social service systems at both the federal and state levels. Better programs informed by better data mean fewer emergency room visits, fewer costly incarcerations, fewer children entering foster care, and fewer families pushed into terrifying crises. The central point here is simple but critical. Investing wisely is not just a public health imperative, it's a fiscal one as well. And that's why this chapter emphasizes not only what we fund, but how we design, implement, evaluate, and scale these investments. If we want better outcomes, we need to change how we decide what to fund and how we learn from these investments. First, we need a consistent framework for measuring return on investment, ROI, across drug policy programs. That doesn't mean reducing outcomes in dollars alone. It means understanding clearly which interventions reduce deaths, increase treatment retention, lower recidivism, and stabilize lives, and which do not, and also why the programs work. So that information can be rolled back in to the next iteration of the programs. Without a shared framework for assessing these programs, we end up making less than optimal decisions. With one, we can see what works, why it works, and where additional investment will do the most good. Second, we must invest in near real-time data on drug use, overdoses, and treatment outcomes. Today, too many decisions are based on data that is months or even years out of date. In a fast-moving drug environment, that lag costs lives. Near real-time data allows rapid learning and course correction so programs can adapt as conditions change rather than waiting for the next crisis to reveal failure. This also means not just national data, but very specific data for each community and each program. That's the only way to know if programs are working and how to make them better. Third, we need to put investments in effective pilot programs to work by expanding research-tested pilot projects nationally while carefully overseeing the expansion and implementation of programs as the whole national effort grows. That means using implementation science, a fairly new field that usefully zeroes in on how programs can be implemented most effectively. This approach, supported by federally funded NGOs, will take proven approaches and effectively expand them nationwide through the work of the 15 Focus Center of Excellence that this video series proposes. And I have a slide again on those at the end of this video. These centers would not invent new ideas for their own sake. They would help states and communities adopt, adapt, and sustain approaches already shown to deliver results in specific key areas. Finally, none of this is without people. None of this is possible without people. We must invest in training and professional development for the next generations of leaders entering government, leaders equipped to manage complex systems, interpret data, and sustain reform over time. Transformation does not happen automatically. It requires expert personnel at every level to make sure these programs produce the results. It requires Capable leadership, institutional memory, and a workforce are prepared to turn evidence into action. Together, these changes ensure that new investments do not simply add programs, but build systems that learn, improve, deliver lasting results for the country. Ideas are not enough. And I have to say, as a policy expert, I love talking about and reading about ideas. But it's truly the execution of these ideas into programs that are funded that saves lives. One of the most persistent failures of drug policy has not been a lack of ideas. It's been a failure to move from ideas to effective execution and implementation. Too often, good intentions are announced without a clear plan for how they'll actually work in practice. Programs are started without sustainable funding, unclear leadership, weak governance, inadequate staffing, and little accountability for results. This book and the video series takes a different approach. Every recommendation I make is grounded not just in policy goals, but in implementation reality, how programs succeed or fail, and what it takes to scale what works and to ensure rapid fixes to problems which inevitably emerge and should be planned for and not thought of as a surprise. This is why each recommendation includes 4 essential elements. First, a responsible, realistic funding proposal, because unfunded mandates and short-term grants are not serious solutions to long-term, complicated, and important problems. Second, a clearly identified lead agency in the federal government, so responsibility is explicit, coordination is possible, and outcomes can be measured by those charged with managing them. Third, a defined governance and oversight structure to align federal, state, and local partners and prevent fragmentation and drift. And finally, fourth and finally, built-in evaluation, transparency, and accountability. So programs are judged by results, not rhetoric, and adjusted when they fall short so they can be improved over time. These elements reflect hard lessons learned from decades of drug policy experience about what it actually takes to turn investment into impact. I wanted to end this video with the slide I showed in the second video to give a preview of where the series was headed. I repeat it here. These are the key ideas in the book and in the video series. Major initiatives that are needed throughout the country with a stable funding source, a governmental lead agency, strong local interventions on the ground, and a center of excellence to help keep everything on track. The people staffing these out-of-government, NGO-run centers will be experts, connectors, trainers, evaluators, conveners of meetings and conferences, producers of guides and protocols to promote program startup, development, evaluation, and continuous improvement. They'll not be shy when a local program has a problem, but rather surface it and help to fix it. Those days of hiding problems under the rug have to really be behind us. Supporters of initiatives, even for a great cause like fighting the opioid crisis, have to make sure the programs work. The people charged with managing these programs, both in government and outside government, have to have a passion for the issue they work on, a commitment to excellence. Having some of this effort outside government in an NGO focused on a certain area has a way of making sure that passion and focus doesn't change, even when government may get distracted by other priorities and other issues. All these NGOs need is a bit of stable funding from the federal government so they can focus not on their organization's survival, but on their work, which is so valuable for the country. It's a very smart investment. You know, I've talked about budget, about these very large numbers, $50 billion drug budget, over $1 trillion a year cost. But these NGOs only need a couple $1 million a year from the federal government to serve as a foundation for their organizations and make sure they can keep a small team together focused on the initiative and helping it move forward. In the next video, number 16, we'll turn our attention to how to protect the next generation, kids in grade school today, as well as adolescents, from the impact of the evolving opioid crisis. Young people face many challenges growing up in today's complicated world, and the availability of potentially lethal drugs is just one of them. I would ask every parent, guardian, aunt or uncle of a child, every school district and elected official to consider Are we truly doing enough now to protect our kids from the drug-related risks they will face as they grow up? It's something important to think about as we think about our national priorities. See you at video 16.